The deadline to sign up for health care through the Affordable Care Act is coming up.
More than 9 million people now have coverage through the health insurance marketplace. The deadline to enroll this year is February 15th. If you do not have health insurance in 2015, you will have to pay a penalty, either 2% of your income or $325 for adults, more than $150 for children. Dr. Vivek Murthy is the U.S. Surgeon General, and he joins us now today to talk about a number of health issues facing Americans. Dr. Murthy, thank you so much for taking the time. Let's start with one of the reasons that you wanted to speak with us. It's the enrollment deadline coming up for Obamacare. What are you encouraging our residents here in Wisconsin to do?
Well, thank you, Vincent, for having me today, and it's great to be with you and with your listeners. As you mentioned, February 15th is the enrollment deadline for health insurance, and I'm encouraging everyone that I meet around the country to sign up by February 15th. And you can sign up very simply on the website, which is e4healthwi.org.
The information that you sent over shows, as you look at it, about 200,000 people in the state of Wisconsin uninsured but eligible for coverage. I guess my question to you is, we're more than a year into the enrollment of Obamacare. Wasn't that supposed to take care of that? How do we still have so many people uninsured?
Well, that's a great question, Vincent. And let me tell you that coverage, from my perspective, and I come at this as a physician who has seen and taken care of thousands of patients, coverage is incredibly important for people to be able to access care and also to have the peace of mind to know that when they're sick, that they can actually get the care that they need. And fortunately, we've had over 175,000 people in Wisconsin who have actually been enrolled through the exchanges. And over 90% of the people who have enrolled have actually received financial assistance. So you're right that our work is not done, though, because we still have more people in Wisconsin who are not insured, who need to sign up before February 15th. And that's part of the reason I'm here, is to make sure that people know that there are opportunities to get financial help and to get insurance coverage, and that we want them to take advantage of that.
Dr. Murthy, while I have you, another issue facing America right now is the flu outbreak. Wisconsin really, according to the CDC, one of the sickest states in the nation. We've been hit very hard. I know there's a hearing on Capitol Hill about the effectiveness of the vaccine today. Anything you can say to our folks here about what happened with the vaccine and how we missed on the dominant strain?
It's a good question. I mean, I am concerned about flu, and Wisconsin has been hard hit, as of many states, actually, it turns out, around the country. And with regard to the vaccine, I know there's been concern that it is not as effective as it has been in prior years. And the truth is that the vaccine efficacy varies from year to year, because we have to make decisions almost a year in advance about which strains we're going to target with the vaccine. But the bottom line is that while the efficacy might be lower, there is still some efficacy for the vaccine. And it's important for people to get the flu vaccine, because it does help protect some people from the flu. What's also very important, though, is that if you think you might have the flu, if you have high fevers, if you've been in contact with somebody who has the flu, then it's important that you see your doctor right away, because getting started on antiviral treatment early can be very helpful in reducing symptoms, reducing the time course of your illness, and preventing you from getting hospitalized.
Dr. Vivek Murthy is the U.S. Surgeon General. Sir, thanks so much for your time. Appreciate it.